Hello everyone, I'm Yelitsa and I will provide a detailed analysis and conclusion of the influenza season in the United States. The United States has an influenza season where more people than usual suffers from the flu. Some people, particularly those in a vulnerable population, develop severe complications and end up in hospital. Hospitals and clinics need additional staff to treat these patients adequately. The Medical Staffing Agency provides this temporary staff. Determine when to send staff and how many to each state. The agency covers all hospitals in each of the 50 states of the United States. To assist Medical Staffing Agency in supplying temporary healthcare workers to hospitals and clinics in the time when additional staff are in high demand. To delve deeper into our analysis, we will ask the following questions next. When is influenza season? Who is the vulnerable population? Where to send staff? Observing demographics, we can see that influenza season increased activity from October and lasts until May in most of the United States, reaching the peak in December and lasts until March, with the highest mortality rates based on our line chart. Upon examining closer data for each year during the peak season, it becomes apparent that influenza trends have remained consistent in recent years, with the highest numbers of the flu-related deaths occurring this time. The next question we need to address is who is the vulnerable population? After analyzing the chart, it becomes evident that people who are over 65 years old are more prone to severe health issues and flu-related death compared to younger age groups, based on influenza mortality rates from 2009 to 2017. To further support this conclusion, we investigated the relationship between the population and mortality count of individuals over 65 years old. Our findings revealed a strong positive correlation indicating that the population over 65 years old is a significantly higher risk of developing severe health condition and a flu-related death. It also implies that the population of this age group increases, there will be a corresponding rise in the number of deaths, requiring more medical resources to address the situation in their respective states. For the purpose of this project, we will focus on the population over 65 years old. Where is influenza the most prevalent? Based on a map observation, it can be concluded that there are 12 states with a higher number of the vulnerable population affected by influenza. These states have the highest percentage of the adults over 65 years old considered vulnerable. Therefore, it's imperative to provide additional staff in these states to address the increased demand for the medical attention. On the bottom, we observe the future influenza trend for the same 12 states above. According to our prediction analysis, the mortality rates from influenza in 2018 is projected to be similar to rates recorded in 2017 and 16. Our finding indicates that mortality figures for The upcoming year will likely follow the same pattern as those observed in the previous years. The influenza season differs from the state to state, with a consistently higher mortality rates in the southern regions. The influenza season experiences its peak period from December to March. Vulnerable individuals over the age of 65 are at higher risk of experiencing influenza infection due to their health conditions. Trends for this age went up in 2017 and will remain the same for 2016-18. Some that may be recorded as pneumonia or other respiratory conditions without specifying the underlying flu infections. Recommendation: Vaccinate campaign should emphasize the importance of vaccinating vulnerable individuals to prevent and reduce influenza mortality rates. Public education: educate the public about influenza, its symptoms, and preventative measures. Also guide good hygiene practice to reduce the spread of the virus. Hospital preparedness: hospitals and healthcare facilities prepare for the increased influenza activity during the peak season. This involves ensuring sufficient staffing, medical supplies, and equipment to handle the potential surge in flu-related cases. The allocation of the temporary staff is determined by the regions with a high population of the vulnerable individuals. The ranking is based on the number of deaths, indicating a higher flu incidence among the population in those locations. These states have the highest percentages of the adults over 65 who are considered vulnerable. By creating a ranking of states based on the number of the vulnerable population over 65 in period from 2016 to 2017, we can prioritize the distribution of additional medical personnel. States ranked from 1 to 8 should be highly prioritized as a high need in staff changes. 60% of additional staff needs to be sent there. States ranked from 9 to 20 should be the medium need in staff changes. 25% of additional staff to be allocated. States ranked from 21 to 51 are lower priority for staff changes. 15% of additional staff to be allocated. It is recommended that these modifications be implemented during the peak influenza season from December to March. A further analysis to identify other vulnerable population with a pre-existing condition. Thank you.